This is the MedicCast, May 23rd, 2011.
Transmitters? We don't need no stinking transmitters.
This is the MedicCast, a podcast for EMS providers by EMS providers, featuring EMS news, products, tips, tricks, and commentary. So grab your gear and glove up. Here's today's show with the pod medic, Jamie Davis.
Well, good day and welcome to this week's episode of the MedicCast. I'm your host, Jamie Davis, and I'd like to welcome everybody to the program this week. We have a lot going on and a lot coming up for you, so we just want to get jumping into the show here. I do want to remind everybody to head over and check out links to everything discussed in this episode over at the MedicCast blog, and that's available at mediccast.com/blog. You can find all that information there. You'll also find links to how to get in touch with me. Of course, you can email me, podmedic@mac.com. Call in on the voicemail line, 941-306-3342, or find me under the handle PodMedic at many of the social media sites out there. So I hope you'll go ahead and find me there. In the meantime, we're going to go ahead and jump in just some brief check-ins with some of the listeners who had some questions and comments from previous episodes. So today is group email day. We've just gotten a lot of contacts recently, and it's because of the way the EMS systems are set up that a lot of programs actually begin their programs in this part of the spring, and they go for a whole year and graduate at the end of next year. So they start at the end of the current semester and run through the end of next year, the same concurrent semester. And so I've gotten a lot of check-ins from new listeners, people that are becoming EMTs or paramedics, prospective members of our profession. And I just wanted to kind of check in with them, and they had all asked pretty much the same question. Any advice I could give them on how to prepare, how to be better able to get through the classes, take the classes, and move forward as an EMS professional. And so I'm just going to kind of just give out the blanket advice here. I think it's a good option for everyone, and that includes existing providers, to keep these types of things in mind. We do continuing education as existing EMTs and paramedics, and the reason for that is that we never stop learning to be good paramedics and good EMTs, good medical professionals at any level. And that's just something that you'll see common across the healthcare professions. Everyone does continuing education. Things change, treatment protocols change, and also some of the ways we can interact with our patients can be made better. So there's lots of different ways to improve yourself. One of the things as a new student that you can really pay attention to is to really stay up on your reading. I know a lot of you are going to say, I never read those textbooks when I go to classes. I don't read ahead of time. I'm going to tell you that the best way to stay up to date and knowledgeable about what's going on is to read ahead in the book and make sure you're prepared for whatever the next class is covering. It doesn't have to be a full chapter read. It could be skimming the headings in the chapters, looking at some of the artwork, and I'm not saying just look at the pictures, but try to understand some of the graphs, some of the charts, some of the tables that might be displayed in the book. Kind of get an overview picture of what's going on if you don't have time to read the whole thing. You can do that in 15 or 20 minutes for most chapters and get a good understanding. Look at the objectives at the beginning of the chapter and read the questions for understanding at the end of the chapter. When you're done the lecture with your instructor, you should be able to answer those questions. And if not, you'll need to go back into the reading and do a more thorough read of the chapter. But to get you prepared, because then you have an idea of what you're talking about when the instructor gets to it. And if you have any questions, anything that came up when you were looking over the chapter, when the instructor gets to that part and they aren't able to clarify it the way you need it clarified, you can then ask an intelligent question. Now, there are no stupid questions. Obviously, that's something that every instructor will tell you consistently, but it always makes you feel better as a student to be able to ask a question that's very on topic. And so if you've done a little bit of preparation, and not a ton, but a little bit of preparation, 15 or 20 minutes per chapter that you're going to cover that week, it'll make a huge difference. And it's just the standard advice I can give to anyone. There's a lot of material and information that's covered in even an EMT basic class to bring you up to speed on patient care and treatment. So you need to really dig in and gain that knowledge. A lot of anatomy and physiology is covered, a lot of those things that are necessary for you to be a good EMS provider. So keep that in mind. And I want to thank all of you. I think there's like 10 of you that sent me an email or a Facebook question about that, and I just want to thank you for that. We're going to go ahead and jump on into this week's news. I do want to continue to remind you to make sure you are getting in touch with me. Send those emails in to podmedic@mac.com. Even if I don't mention you specifically here on the show, I will respond back to you to let you know my ideas about what you're asking, or perhaps to tell you that listen in on a future episode. I'm going to talk about that topic coming up soon. And so either way, you'll hear back from me. And I look forward to hearing from each and every one of you. And hey, it's coming up. It's EMS week. If it isn't already where you are when you're listening to this, it will be soon. Happy EMS week, folks, and continue making all of us proud here in the MedicCast community as we move forward. It's time for the news, and we'll kick off with a story that wraps up EMS week. Of course, a lot of you have just recently celebrated EMS week, so if you have, congratulations and happy EMS week. But it is something that I'd like to find out more about, how you celebrated EMS week. It's one of those things that's hit or miss around the country. And so I would urge you to look at some of the articles that I've provided here on the show about EMS week, some of the links you can find online for what other places are doing for EMS week, and start thinking about planning for EMS week next year. You know, it is one of those things that comes around every year. It's something you can schedule, and it's something that you can really put some interesting educational things together for your community, ways to recognize other EMS professionals and yourself, to say, hey, thanks for being part of my partnership, part of my brotherhood here, and making sure that we continue to build on celebrating EMS week for both educating people about what we do and also for giving ourselves a pat on the back for doing a difficult job well. So I want to encourage all of you, if you're in a supervisory position or even if you're just getting started, think about next year and EMS week and what are you going to do to celebrate EMS week? Is it going to be putting a sticker on your car? I know somebody who got a new tattoo for EMS week, so it could be anything. But I'd love to hear what your thoughts are. Send those emails back in and let me know. There's a great article here from the National Emergency Medical Services Week from the American College of Emergency Physicians. And they are the ones that really sponsor or got started with EMS Week to recognize all the EMS providers out there. And so I want to thank the EMS physicians for making sure that we got a week and a time of recognition for what we do. And also to let you know that there are a lot of good articles out there on what different communities have done. Sometimes it's just a great opportunity to get your local newspaper, news outlet involved in ride-alongs, getting them involved in talking to students in training, finding out a little bit more about the depth and breadth of training that we have, describing the system aspects. Are you volunteer? Are you paid? Are you some kind of hybrid of the two? What do they expect when they call 911 and ask for EMS to come to their house? Those kind of things are important. And again, setting expectations for your public, for your communities that you serve, will help them to understand when things get difficult that, hey, we can't be everywhere at once when there's a disaster going on. We can't be able to get to you when there's bad snowstorms and things like that. Again, it all helps to educate about what we're doing. Next up on the news is a really cool story. You know, I don't know if you've ever looked at concept cars. Concept cars are really the auto manufacturers, whether here or in Europe. They show off their thoughts about what the cars of the future will look like. You know, and I obviously, if you've ever looked at the book, you know, hey, where's my flying car, right? You know, we don't have that flying car yet, but they still create concept cars looking 10, maybe 15 years down the road. What is the car going to look like? How is it going to perform? What is it going to be made of? One of these concept vehicles at a recent event was from Mercedes-Benz, and they portrayed a concept emergency vehicle ambulance at an expo in Germany. Now I'm hoping that Kyle David Bates, who was over at an EMS conference in Germany, got to see this concept car. So we're going to ask him about that. Of course, Kyle is the host of the First Few Moments podcast, and is just an excellent professional in and of his own right. And so I'm hoping that we'll be able to chat with him about his experiences in Germany in an upcoming episode. But really, I just want to, this is a great article, and it looks at the vehicle. It offers a lot of different things. It's an ambulance, but it is shaped like an automobile sedan, not like a traditional ambulance. When we think about it, why do we have to put a patient reclining on a cot when they're a priority 3 patient? Couldn't they sit up on the bench? Couldn't they sit in the back of a car? Obviously, if you need a critical care transport, that would be different things. But for transporting your average patient, couldn't they just ride in a vehicle with a provider sitting back there with them and a bank of monitors in the back, across the back of the front seat? And you can hook them up, you can get a blood pressure, you can treat them right there. And if there's an issue, if they're stable and they're priority 3, there's no reason they can't be transported that way. You can do a basic assessment. You're prepared for just about everything. You can even start an IV and have it hanging right there, ready to go. But you don't have to have them on a cot. And I think that this is something that we can look at. So it's just a neat thing. I'd urge you to check out the concept car image and let me know what you think. I think it's really cool. Of course, it's a sleek German sports car outfitted with lights and sirens, and it looks pretty cool. But you should check it out. There's a link in the show notes, so go ahead and follow that up. Finally, just another thing to follow up and wrap up EMS Week. Remember I talked about what do you do for EMS Week and how do you reach out to your public. One good example of that is this article I found that is from the Mukilteo Beacon. I hope I'm pronouncing that right. This is a website that is looking at what happens when you call for an ambulance. And it's a great article. It looks at, asks those typical questions. It's like an FAQ for EMS patients. When you call an ambulance, where does your ambulance come from? Where do you end up going? Can you pick the hospital you go to? A lot of patients say, well, I don't want to go to the X hospital. I want to go to Y hospital. Well, we might have to take them to X hospital because it's the closest facility based on what's going on with that patient, or the nearest appropriate facility. It depends on what our transport protocols are. So we need to check on that. When do you get to the hospital? How long does it take to get EMS to your house? And then how long does it take them to transport you to the hospital? Does licensed sirens really make that much difference in transporting patients? We know that really doesn't make a huge amount of difference in time for your average transport. But do the patients know that? So there's all kinds of things. Check out this article. I think it's something you could adapt for your area, your district, and you don't have to wait for EMS Week to run it. You could run it next week and just talk about recently having EMS Week, or use it as a way to look at an increase in call volume during the summer months and vacationers, travelers, whatever, people outdoors more. So use this as an opportunity to see what's going on. That's all of the news items this week, and I urge you to check out the links over at MedicCast.com/blog. You'll find links to everything discussed in the show notes, and I urge you to follow up on those links and check out the full articles. And also get back to me if you have any comments or suggestions for future articles or about these articles covered in this episode. This week's tip of the week is going to be a continuation as we look at some of the skill stations from the National Registry Test and help you prepare to take some of them, whether you're BLS provider testing or an ALS provider. So we did airway over the last several weeks, off and on for about a month or so. We're going to go ahead and jump in and talk a little bit about cardiology over the next 2 episodes. And we're going to do BLS cardiology and then ALS cardiology. So paramedics, doesn't mean you get to turn off this segment. ALS providers really should have a good solid basis in your BLS skills, or you may be a preceptor for an upcoming test. And either way, I think you're going to get something out of this, and I hope you will continue to listen. So without further ado, let's jump into part 1 of our segment on National Registry testing for skills and cardiology. We'll start off with testing at the BLS level. Now, first off, we want to talk a little bit about what are we talking about in the different skills areas. And one of the things is that BLS cardiac arrest management is the primary skill station for the BLS provider. And this is BLS cardiac arrest management with bystander CPR in progress, AED use. It's all encompassing. It's basically a BLS mega code. There may also be a medical patient scenario when you're testing, and that medical patient may have a cardiac problem, so you might be asked to assist with nitroglycerin, or in the ALS case, you might be asked to run through a medical patient that has to be treated. And of course, you have the dynamic cardiology stations and the static cardiology stations that test that. But in the BLS level, you may have one of your medical patient scenarios may have something to do with dealing with some cardiac issue aside from cardiac arrest. The ALS level, there is static and dynamic cardiology. And again, you don't usually have a medical assessment because they're so much covered in the dynamic and static cardiology stations. But just so you're aware, the patient assessment scenarios may have something about cardiology in it. So you might need to see something there. But generally, for the ALS level, it's just really isolated to static and dynamic cardiology. In this segment, I'm going to endeavor to follow the 2010 ECC guidelines, and also want to remind you to download your skill sheets and the test manual from the National Registry Exam Coordinator documents site. I have linked in the show notes to that. It's not under lock and key. It's not super secret. You can go out and find that information, and I urge you to do that. When you download the test manual for your test, whether it's BLS or ALS, you'll be able to just get a feel for how the test is going to go. They have scripts in there that are read to you when you get started. So you can say, hey, I recognize that. He's supposed to read that to me. You'll understand what the individual preceptors are supposed to be looking for and thinking about when you go into the skill station. Again, preparation for this test is 99% of what's going to get you through it. And part of that preparation is understanding exactly how this test is structured. Also, just as a point, I want to point out to you, if I'm talking about the 2010 ECC guidelines and your instructor is saying, no, we're still operating under the old guidelines for some reason, whatever the case may be, as always, in any of the tip segments here at the MedicCast, please follow your instructor's guidelines or your protocols. I'm going to be giving overviews based on either my guidelines and protocols or some other specific set of guidelines that I have found for you, but that doesn't supersede you doing what you're expected to do in your protocols. It's your job to follow your own scope of practice and stay within that scope of practice. Let's talk a little bit about preparation for the skills test. We talked about this at the airway stations, but it's just as important here. There's nothing that takes the place of practicing hands-on on these skill stations and getting in the mode of being adept at switching out between ventilations and compressions on CPR, between getting the AED set up while someone else is doing it. I mean, this choreography is important, and getting a handle on that ahead of time is going to take practice. Also, memorization is part of it, and repetition. When you have to think about protocols, medication doses, things like that, AED shocks, everything has to be done in a certain order. You need to have that memorized, and then you need to repeat it. So memorization and repetition is part of it, just like any other learning. One thing we don't do enough of, and we talked about this in the past, is visualization. When you're not at school and you don't have a mannequin in front of you and you don't have an AED trainer in front of you, how do you practice when you're done reading and memorizing and repeating to yourself the steps? Well, you can close your eyes and visualize yourself performing those steps. Athletes do this all the time. It greatly improves their ability to perform the job that they have to do as an athlete. And there's no difference between their psychomotor skills, the tying of their knowledge and their muscles together, as it is for you to use your psychomotor skills to tie your knowledge and your muscles together. So visualize yourself doing these things. Make sure you have the skill sheets, and make sure you're getting good study partners. When you have those study partners with you, you can work on things. You can have them watch for specific things. You can work on things you're not good at. Look for your weaknesses and get that person to help you develop them, just as you help them develop around their weaknesses. When you're testing on the skills station, there's a few things that you can do to help prepare the night before or the days before. And one of them is rest, relax, and food. The night before, get a good night's sleep. Make sure you're relaxing the day before. I really don't counsel anyone doing a lot of hard studying the day before a test, any test. You should know it by then. If you don't know it by then, I really doubt you're going to pass. And so prepare up front, and then when you've practiced for the last 3 weeks and you've worked hard on it, you may think and worry, and that's okay, that's normal. But I would urge you to take that last day off and relax. Go to a movie, do whatever it is you do for fun, and relax for that day. Rest up the night before, get a good night's sleep. Make sure you get a good breakfast. If it's a morning test or whatever the nearest meal is, make sure you've had enough to eat so you don't go hypoglycemic in the middle of the test. You want to make sure when you go into your skill stations that you're wearing gloves. We've talked about this before. Scene safety BSI is how I end the show. It's because it's one of those things you have to keep in mind, and it can be a fail point in your skill stations. Wearing gloves from the beginning of the skills test through all of your stations and then only taking the gloves off at the end of the day when you're done testing is one way to make sure that you're always showing that you're thinking about BSI, and you won't have to worry about forgetting that part of it. Whenever you go into a skill station, you do have the opportunity before it gets started to just look over the equipment. So if you are testing and it's not your home testing center because you're maybe doing a retest and you are testing and you have an AED trainer or you have a defibrillator model that is not one you're familiar with, you can ask for some limited instructions on how to make it work. Now, they're not going to show you how, for ALS providers, how to sync appropriately for sets of shocks when you're trying to do synchronized cardioversion. They're not going to show you how to do your job for you, but they will point out this is the on-off switch, this is where all the settings are, and this is how you can change the screen. Those types of things that may be different from manufacturer to manufacturer. The same thing is true for bag valve masks and equipment. You can make sure that everything's there and in good working order. Finally, you want to make sure you take a deep breath, okay? It's just to calm you down. You're a ball of nerves walking into that room, and just the act of taking that deep breath can be huge in helping you just to settle down just a little bit. You know, a little bit of edge to you, a little bit of anxiety is healthy and helps you get through stressful situations, but too much anxiety is bad. That deep breath can take that anxiety level down to a manageable level because it basically forces you to slow down. And when you go too fast is when you make mistakes. And then go ahead and you'll start your testing station. So let's kick off with the BLS cardiology skills, looking at sudden cardiac arrest management, bystander CPR in progress here, and AED use. So we're going to look at this for the BLS station, and let's go ahead and kick off. Of course, first you're going to start off with scene safety BSI. You want to make sure you're either showing or verbalizing that you are cognizant of body substance isolation, universal precautions. You want to briefly question the bystander about what happened. Now, this briefly, I mean, what happened? I don't know. He was laying here in the road. We found him like this. He's not responding, and I started CPR on him. That's all you need to know to move forward for this patient. Okay? You're going to go ahead and get the AED out. You want to make sure that you have your AED handy. You're going to get it out, attach it to your patient. You want to briefly check responsiveness while you're doing that. Clearly, if they're not responding to CPR in progress, they're not responsive. So you can just be cognizant of that, verbalize that you do see that the patient is still unresponsive during bystander CPR. Get your AED, turn it on, attach the AED to the patient while CPR is in progress, and then clear the patient to allow the AED to analyze the patient. So you'll direct everybody to stop CPR and make sure everyone's not touching the patient. They'll now analyze the rhythm, and it will be ready to deliver a shock. So it's in this scenario, it's going to be assumed that it will deliver a shock. So if you have an automatic AED and it's going to automatically deliver that shock, it will. Generally, for us in the EMS sector, you don't have fully automatic AEDs. You have semi-automatic AEDs requiring you to push the shock button. So that will be something that you will do here. You will then immediately direct the rescuers to resume CPR. There can be very little interruption. You're going to hit the shock button, and then you're going to go start CPR immediately. They'll continue to resume CPR for this patient. And you're now going to get a brief history of the event, a little more in-depth from the bystander while you wait for the 2 minutes of CPR to complete. When you find out that there's more information about the event, you'll then confirm that there is good CPR going on. So you're going to verify ventilation. Is there good chest rise, good bag mask seal? So watch how that's occurring. You're also going to verify that you can palpate a pulse during compressions, either a femoral or a carotid pulse during compressions. You should be able to, and you can verify your compressions effectiveness that way. You'll now want to prepare and verbalize or actually insert an airway adjunct, either a nasopharyngeal or oropharyngeal airway. We've talked about them in another segment. Measure them appropriately, find the correct size, and then insert it if you are indeed going to actually insert. I think in this station, in many places where I've seen it, they just want you to verbalize that you're going to go ahead and put an airway adjunct in. You're going to go ahead and continue to direct ventilation of the patient. And you're going to make sure that oxygen is being delivered. You're going to make sure that there is CPR continued for 2 minutes. At the end of 2 minutes, the AED will tell you to stop and continue with analysis. So you're going to clear everybody from the patient again, make sure everyone's clear. I'm clear, you're clear, we're all clear, while you move your hands and look up and down the patient. And then you're going to go ahead and analyze the rhythm. You're going to go ahead and make sure that you have the AED set up for the second time around, and then if indicated, shock the patient. Make sure everyone's clear, hit shock, resume CPR immediately. You're now going to verbalize patient transport options. We're going to rapidly package this patient, transport them to the nearest appropriate facility. We will attempt to rendezvous with ALS en route, blah, 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 blah. You'll go down that list. And really, that's all there is to this particular skill station. This is something that you guys have probably practiced 100 times. If you're an existing provider, heck, you've seen it done in real life and can talk about it. But certainly, there's some things that you just want to keep in mind. One of the things is critical fail points, okay? As always, no BSI. If you didn't verbalize or actually take BSI, you are going to be failing. If you didn't check for and make sure that the AED was ready to go and rapidly put to use. So again, at the beginning, when you come upon bystander CPR in progress, you're going to briefly get a quick overview of what's going on, what happened, and then you're going to get the AED and apply it to the patient and make sure that they are getting the AED in place, and then as soon as it's in place, analyzing that rhythm and delivering a shock. Okay, that's very important. If you have interruptions of the compressions that are deemed to be too long, okay, 10 seconds is the longest you can stay off the chest if you're not analyzing the rhythm. Okay, so once that shock's delivered, you got to get back on that chest in less than 10 seconds. And darn it, if you're working with me, you better be doing it in less than 2 seconds. There's no excuse for you not to be standing there with your hands ready to go, inches above the patient, shock them, and then you drop down and start compressions immediately. If you fail to get rescuers or bystanders clear prior to shocking them, that's a fail point. That's obvious. If you are unable to operate the AED safely, if you're unable to correctly deliver a shock, you didn't plug the pads in, you didn't pick up that they weren't plugged in, and you went ahead and tried to deliver a shock or didn't do something properly, that will make sure that you fail as well. If you prevented or delayed use of the AED for any reason, that also will cause you to fail this station. Just keep those things in mind for the BLS station, and keep those things in mind if you're an existing provider. Are you doing those things, and are you practicing those things? There's no reason not to practice when you're back at the station. I'd say once a week, getting together with your crew and practicing handling a cardiac arrest patient with different people helping out. Just stopping by and say, get the mannequins out, it's time for our CPR practice of the week, and make a little scenario up and run through the scenario. It's a great opportunity to work on that choreography that's so important. And so you can get these skill sheets downloaded and use them to keep you up to par for your skills here at the National Registry. Again, I would urge you to follow up on the information that I've collected here. And again, there's be links to the National Registry and other information over in the show notes for this episode at mediccast.com/blog. And of course, don't forget to check back for part 2 next week, when we'll be coming back with our ALS section on National Registry Cardiology. And that's going to wrap up this week's episode of the MedicCast. I want to thank everybody for checking out the show this week and urge you to head over and find all of the follow-up information for this week's tip of the week and for everything else discussed in this episode over at mediccast.com/blog. You'll find links to the show notes right there at the top of the page. You can click on that link and you'll find all of the episodes listed. And of course, the most recent episode will show up first, and you can scroll down and find previous episodes in reverse chronological order. If you'd like to get back in touch with me about comments or suggestions for future episodes, corrections, maybe I've made a mistake somewhere along the line and need to get it straightened out, go ahead and send those in to me. You can email me, podmedic@mac.com. Of course, you can always leave a comment over on the website under any of the articles. There's a comments link, and I urge you to use that. You can also go ahead and call in on the voicemail line, 941-306-3342, 941-30-MEDIC, and get in touch with me. I love to hear from you, and I look forward to getting your calls and hearing your opinions and your voices here on the show. If you want to go ahead and catch up with me on Facebook and Twitter, you can do so. You can find me over at facebook.com/podmedic, twitter.com/podmedic, and continue to grow the MedicCast fan page. We're almost to 2,500 fans over there. Go ahead and continue visiting. Become a fan of the MedicCast by visiting facebook.com/MedicCast, and you can become a fan of the show right there. And I hope you will do that, because it's a great way to kind of connect with me in a different way. I put things and links and different things over on Facebook that may not make it onto the MedicCast blog. So it's another good way to stay in touch with me and follow up what's going on, and also have conversations with other fans of the show by commenting on posts and information that's been placed over there. And I hope you will continue to support that. That's it. We're going to go ahead and close out the show with some great pod-safe music. In this episode, we're going to bring back Henry and the Invisibles again. This is the song Up and Over. I hope you like it. It's one of the new bands, and I've been playing a lot of Henry lately here for myself, and I like playing those kinds of songs for you all as well. So if you like what you hear, you'll find a link to Henry's website in the show notes. Go ahead and let him know you heard it here on the MedicCast. And again, support him. If you like some of these songs, you'll find links to purchase them. You can just click on the link for iTunes. It'll bring it up. Won't charge you anything, but you can open up the iTunes link for Henry's music. And then if you like one of the songs, you can go ahead and purchase it. It's a great way to support Henry and let him know that you appreciate him and providing his great music to people like me and other good podcasters out there. So thanks a lot, Henry. And without further ado, we'll get into his song. I'm Jamie Davis, the Pod Medic. I'll be back again soon with another episode here of the MedicCast. In the meantime, please remember, scene safety, BSI.
With every mile, come up and we're coming to bend over. Ask you please for a little slack. You said no, and now we're coming back. We come up and